Okay, so I feel like I may have told people that a high urine pH is acidic, and actually, I really just didn't do any of the research that I really needed to do on that. So I was supposed to be like talking about how to know if you're being gaslit about having mitochondrial dysfunction or if you're being gaslit about having diabetes slash insulin resistance. And I was talking about my symptoms, me curing myself, and test results, but I'm pretty sure I was saying some things backwards or just kind of completely wrong. So, I'm going to start off by saying high pH is actually alkaline, not acidic. I was very backwards. So, my urine pH was 8.5, and then I also had the proteinuria. And I was saying that, like, I'd assume that the IC, or quote unquote IC, which stands for something that I probably can't really pronounce, but interstitial cystitis, I think I did it that time. And it's pretty much like a blanket diagnosis, still one that people usually wouldn't get. Somebody with symptoms of that would probably just be told the usual, you're just sleeping around too much, or that they're just mentally ill or whatever. But it's a bullcrap little diagnosis for people that have bladder pain and don't really know what's causing it. Which obviously it would be bacteria that may not be showing up in a test. And of course, parasites. That would be the number one response that I would give somebody for that. But also, along with that, it's obviously caused by insulin resistance. But that's not what I was supposed to be saying, though, actually. I was supposed to be getting to a point. And I don't remember what it was. Hold up. Okay, I remember now. So, I was saying that, like, I guess the IC would be caused by having acidic urine, and that it was making the bladder wall inflamed. Or not even that, but for whatever reason, my bladder wall became inflamed, and that's why I was able to actually feel it, because apparently when people have I think high or low urine pH, now that I actually know the difference, they usually don't really have a lot of symptoms, or they have none, and it's not really something you can usually feel, apparently. So I shouldn't be able to really tell if something's going on, but I could. And so that's what I was saying, that maybe, like, the acidicness made the bladder wall inflamed, or something, me trying carnivore did, and then that's why I was able to feel it. But I was just completely wrong, because actually my urine is alkaline, not acidic. So I was just really backwards anyway. But I mean, I'm sure that the first thing, or my first idea, is possible, but that's actually just not the situation that's going on right now. So, what was the other thing? Oh, yeah. Apparently, alkaline urine can also, like, make it easier for bacteria to build up since it's not acidic. So, that can cause some issues. I already spoke on the whole thing with how insulin resistance can weaken the pelvic floor, and how low blood sugar and even high blood sugar can damage nerves. And then low blood sugar would be your body not even, like, being able to get enough sugar and process it to function. And then I was saying that maybe the proteinuria has something to do with the inability to digest protein and, like, eating a lot of it. And I mean, that's still a possibility. But actually, overall, the kidneys are there to filter blood. And the protein in the urine is mostly spilling from the blood. Which is also why when you have, like, end stage kidney issues, there will be blood in your urine. So, the protein spills from the blood, not necessarily from food. I'm not saying that it couldn't happen, but yeah, so then when it comes to the interstitial cystitis, when blood sugar goes up or goes down, or when it's rising or lowering in that moment, that's when the pain kicks in. And then I guess side bacterial overgrowth from maybe the sugar or whatever in the world, that's when the bladder pain and even kidney pain could get really bad, and also the pelvic floor dysfunction. And then that coupled with like just a lot of inflammation going on at once due to hormonal imbalances, especially when either you're on your period or you're supposed to but you're not having them because your blood sugar is too low. That can also make the pelvic floor dysfunction pain worse. And then insulin resistance can also cause back issues and spine cysts and cyst. Oh my gosh. It can cause cysts in the spine, the ovaries, even the kidneys. And I didn't even know that there was such thing as kidney cysts till recently. But hopefully everyone here already knows that insulin resistance causes PCOS, which is polycystic ovarian syndrome. So it all makes sense in the end. But anyway, all that stuff together at once can cause a lot of pain and a lot of inflammation. And I remember how much pain I used to be in when I was in my previous situation, and knowing what I know now, it makes a lot of sense. And like I say, medical professionals will play a lot of games with you, and it seems like I don't know, like they're always trying to kill me in some form or fashion. And I don't go to doctors, but it's like the experience I have had with them. That's what it is always going on, which is very interesting. But yeah, so I mentioned the whole situation before of like how um I don't even know how to summarize it. I guess just watch the other videos because I don't really want to go back over all that because I don't want to end up somewhere else. But pretty much it's just been a lot of games about the whole situation. And I remember when I used to get in support groups, a lot of people, even up until somewhat recently, just like other people I've been around, have thought that like I had IBD or something like that. A lot of people would mention MCAS to me and MS, and I think something called MC, but maybe not. Maybe that's just in my head, and that's also me thinking of MS, but maybe mixed with MCAS. I remember somebody with Lyme disease thought that maybe I had that, and come to find out, really, the whole time, it's not even all that. It wasn't even like some mystery thing. I still had insulin resistance from the iatrogenic effects, and I had just been getting gaslit into thinking that I didn't, and I had actually went from type 2 category to type 1, which is why I dropped down to 80 pounds at 14, and then everything pretty much went downhill from there. And then by 15, I couldn't digest food anymore, but I didn't know that either. And another thing that is really common for medical professionals to do to people that people talk about a lot is they tell people that it's normal to like eat something and then hours later you're throwing up undigested food that should have been digested. Like if you ate a strawberry if you ate strawberries at 8 a.m., you shouldn't even still have strawberries in your stomach at 3 p.m. to be throwing up strawberries. That's a sign of gastroparesis and even like not having enough stomach acid and digestive enzymes. It's a sign of a lot of stuff, but you're not digesting stuff right. And then also, um, having urine that smells like what you ate, like your urine shouldn't smell like salt and pepper. If you've ever been told that it shouldn't. Another thing, oh yeah, undigested food and stool. That should have been the first thing I mentioned, to be honest. That should honestly never ever happen. People are told that it should happen, but it should never happen. That's low stomach acid and low digestive enzymes, and that is not a good sign. And the thing is, the more stuff like that goes untreated, the worse it actually gets. In fact, people have their little ideas revolving around what causes colon cancer and stuff like that. But what really causes that, I mean, there's different things, but when it comes to like digestion and not being able to digest food right, even if you don't know that you're actually not digesting food right, that's what would actually cause colon cancer, because it could cause a lot of different cancers actually, and autoimmune issues, from the leaky gut to the fact that there's undigested food just scraping through your intestines slowly and painfully, causing probably all types of bruises and stuff, along with the bacteria. And so then there's the cuts, and then there's the well, I was gonna say the blood-brain barrier, but I don't even know if that's blood-brain. But either way, the bacteria in the food is going from your intestines into the blood, which is then getting into your body, and then that's a whole bunch of toxins in your blood, and that's what causes that. That's one thing anyway. So yeah, contrary to popular belief, at least when with the mainstream medical system and in the Western world, none of that is normal. You're not really supposed to be crapping out strawberries and peeing out salt and pepper and broccoli. You're not supposed to be throwing up full hot dogs and stuff like that. As funny as that may sound, my younger sister actually did that once, and it was in her sleep. It was a long time ago. That was crazy. And honestly, pretty dangerous. How she swallowed them, I don't know, but it was like cut up hot dogs, and she was just throwing them up in her sleep. And I tried to wake her up, but she slept really heavy, and I did not actually know way back when that happened how risky that actually was. But yeah, so there was that. Okay, I feel like I forgot to say a lot of things. So going back to that picture that I edited in, which has a funny little backstory, that'll probably be 13 minutes. What I found out, especially when I was doing those parasite, and I guess they could work for bacterial and mold cleanses, specifically this one called Scram, and another one that I can't remember the name of, maybe Parify. I noticed while doing those cleanses that the same bladder pain I used to have sometimes when I was staying with relatives that eventually turned into serious pelvic floor dysfunction would happen then. I mean, not really on the same scale, but it would happen. But it definitely wasn't as bad, but it was still really painful. And I was asking questions about it, and then the lady was like, well, did you take the binder? And I was like, oh yeah, I did. And then I started taking the binder. It was Cinnabon. And then when I ran out of that, I used activated charcoal, and it helped. In fact, it would actually make the pain go away within really like a few minutes. And so that shows that it's not just blood sugar issues and the insulin resistance, but it's bacterial, fungal, of course. I mean, I've been figured that, which reminds me of something I forgot to say, but I don't want to go off somewhere else. Okay, so bacterial, fungal, and parasites. That's what that shows is also another cause of this. And yeah, so now I guess I could go ahead and say that thing that I just remembered that I probably should have been spoke on. I don't remember what video it was in specifically, and I'm sure I've said the same thing that was actually really wrong since I've been doing this whole metabolic dysfunction series. But for a long time, I was saying that when I was living with relatives, due to the whole issue with my liver, kidney, and pancreas, and even some brain damage, but all that being down from the iatrogenics, from the neurotoxin drugs, that my system wasn't able to get the mold out because my liver was down, and that was causing the pelvic floor dysfunction, or some of it, and a lot of like the bladder issues. But I was just actually really off, because I was thinking that the liver has something to do with urination in the bladder, but I meant to say the kidneys. Now, of course, my liver definitely was affected by what happened, and that plays a role in like the mold building up, which made my symptoms worse then. But I was meaning to say my kidneys, not my liver. So I just wanted to clear that up for in case the 0 to 2 people who may have even watched those videos really took heed of that. So, yeah, there's that right there. And then here's something else that I'm trying to figure out how to actually explain without it taking 3 hours and 92 trauma dumps. But I mentioned before the whole situation with medical professionals and their gaslighting and their lies, and the mainstream medical system, and them really not even knowing what they're talking about, to the point where it's not even always just about malicious intent. They just really don't know what the heck they're talking about. So I mentioned recently, and honestly since the evidence channels, in fact, I have videos of these situations on the evidence channels, of the whole thing where when I really started to get sick, well, when it really started to get somewhat talked about, there was this whole situation where the doctors were like, well, we know that you're in the Munchausen situation with whole mental health thing, but I mean, it's like, I don't even know. The whole cash for kids system is Munchausen in and of itself, and they played a whole role in it. They tried to act like they didn't, as the usual mandated reporter, but of course they tried to act like they cared. But anyway, they were like, we know you're in this Munchausen situation, and so pretty much we feel like your mom is just like starving you at home, and that's what's causing all your symptoms. And then she's acting like she doesn't know why you're sick. And of course, they were pretty much, not even pretty much, they were like, yeah, you're just getting starved at home. We'll see you in 6 months. Eat more peanut butter. So there was that whole situation, which I really don't want to go back over because I don't want to go off somewhere else, and I have videos where I talk about it anyway. And I mean, for a while, I did like really listen to that whole just try to keep eating more thing anyway. And it's like, well, no, because if I go into all that, then I'll be somewhere else. So to summarize, I already mentioned in another video how dangerous that actually was, because if you can't even digest food and you just try to shove even more food down your mouth that you already can't digest, which is causing severe issues and pain, that's dangerous in and of itself. But I realized something else that made it dangerous, and I was thinking about this earlier while riding the bus. It also is kind of tied to this thing that I mentioned in another video about how, like, when I was back in NC, there was this whole situation where it seems as though, well, not it seems as though, the food on the East Coast definitely made me even more sick, and then also I had to eat even more bull crap there because a lot of stuff with the situation. And so I was at this winter shelter, even though I really don't do shelters, but it started snowing and it was 15 degrees. So I was at this winter shelter, and these nurse people had came out, and they were checking people's blood sugar and blood pressure, because pretty much everybody in there had diabetes, which is a terrible thing since all was really being served was macaroni, bread, cakes and cookies pretty much. And that's the video of itself, but they came out to do that. And they checked mine, and of course, mine was 54, which honestly, the whole time I was on the East Coast, pretty much I was at 54 because I was eating the food, and then it made me more sick for different reasons with the bullcrap they put in the food, I'm sure, and then like just the fact that it was what it was, a lot of carbs. And so I would eat, and then my blood sugar would drop down to 54, and I didn't really have any other options. But the thing is, when I would like just try to eat less of the bullcrap and just eat the salads, I mean, honestly, even that did something. But also the thing with that is that when I don't eat certain stuff, that also can make me go really low too. And so, yeah, that whole situation happened, and it made me, that right there made me think back on the whole eat more peanut butter and start drinking milk again thing, which I had to stop drinking milk because due to the fact that I couldn't digest food anymore, milk was one of the things that hurt really bad. Honestly, every single thing hurt really bad. In fact, it wasn't even just the low HCl, it was the lack of pancreatic enzymes, because what I very recently found out is that actually the semen to be stomach pain, which also, I mean, it would be stomach too, but the semen to be stomach pain that was more so like in the lower abdomen, that would be in my stomach, and it would radiate up to like my chest area, like heartburn, and then my shoulder, and then also cause a migraine. That was actually pancreas pain, not even really stomach pain. And that's something else I recently found out. And then it would also cause cramping. I guess maybe because like the organs were trying really hard to do things that they couldn't do. And so the cramping would happen, and then I wouldn't be able to stand up. Like literally I wouldn't be able to because of the cramping. And I remember my mom mentioned that, so I'd be bent over, and then I couldn't walk either. And for whatever reason, I guess due to like the fact that just so many organs were struggling at that point in time, the cramping would also trigger some stuff with the pelvic floor issues, and then that wasn't good. But anywho, that whole eat more peanut butter thing was also dangerous because I was pretty much being told to eat things to start eating even more of things and more calories from things that were actually causing my blood sugar to dip. And honestly, I wouldn't even be surprised if back then when I had all those symptoms going on, I wouldn't be surprised if my blood sugar was probably like in the 30s or something. But yeah, so the doctors were trying to kill me like usual. And the more I learn, the more research I do, and the more I work through these issues, the more and more I dislike the medical system. It's like people think that I just have the feelings I do towards it because of the little cash for kids system, mental health system branch stuff. But honestly, looking back, there were so many issues and experiences I had with the medical system way before all that stuff started happening. And I even started going through the cash for kids system. Like the whole swollen lymph node thing I mentioned, where I had swollen lymph nodes for years that they're still there they're still there, but they did finally start going down a few years ago. But I had those really bad. They were visible from like feet away from 6 to 11, and I now know, I found out a couple months ago, or at least I concluded that was from mold toxicity. And I also came to the conclusion that that's the same reason my old quote-unquote stepmom's lungs had collapsed, because when those lymph nodes developed, I was living in mold, which most buildings have, or really pretty much all of them. And what was it? Oh yeah, and then there was this whole scalp thing I had got back then too, where I had like these green things growing in my head that ooze slime. I also now know that was a fungal infection, and that took a little while to go away. And to be truthfully honest, I feel like if I would have even went to a doctor about that, they wouldn't have even known what was causing it anyway. So, yeah, there was that, and the doctors would just say, well, it's swollen lymph nodes, and they just said that it was swollen lymph nodes, but they never said anything else with that. But going back to something that I completely forgot to finish. So, back to the whole eat more peanut butter, drink more milk, eat more bread thing, all that bull crap. So, what I forgot to say with that is that due to the fact that all of that is carby stuff, those are things that will cause my blood sugar to go up and then go down. What it really seems more like is like right after I eat it, my blood sugar just goes down. But honestly, well, no, because I started paying attention more recently, and yeah, because people kept saying that it spikes, then it crashes, but I was like, it doesn't really seem like it spikes because it doesn't really go higher than it should, but it still does go up as it does because that's just what happens, and then it goes down. And so that was another dangerous thing about that whole just start eating more, as if like, I couldn't digest food anyway though, so it was just all really stupid. But one of the things with that is that due to the whole me quote unquote being retarded thing, they didn't really care anyway. They being the doctors. So they well pretty much it was like a lot of doctors didn't read the files. So some of them would read the files and they would see different things about my situation and other ones wouldn't. So they would be like, oh yeah, well, we were told she's retarded, so she probably just thinks that she's in pain. But then the other ones were like, well, we're reading your files and then it says that all this is going on. Of course they don't do anything because they don't care. And then I've been severely underweight for some years now. And they were mostly focused on the fact that I was 80 pounds and that was pretty much it. And of course, as much as they focused on it, I still am, because they definitely slowed my healing process. Because if I would have known all the things I know now then, I would have started working on my health a long time ago. Like all that pain I used to be in back then, if I would have known that all I had to do was take an activated charcoal capsule and all of that stuff would have gone away, and I wouldn't have been, well, that and then the butane HCl and the enzymes, and I wouldn't have been throwing up and having diarrhea all day and unable to stand up, I would have started doing that stuff a long time ago. Because for one, just the chaos of the situation, then the amount of pain I was in didn't go good together. It went really, really bad together. And then I went through a lot of sleep deprivation abuse, but the pain only wasn't there when I was asleep. So it's like I'd be trying to go to sleep, but I wouldn't be able to. It was just really, really bad. And they really set me up for more struggling with something that wasn't even something to struggle with, and that wasn't even that serious, to be truthfully honest. But yeah, anyway, if it wasn't for the fact that all these places are scared to give me my medical records because they think that I'm going to sue them, I would really love to go through them just to see what my blood sugar was back then. But I'm sure it was pretty low though, because I remember, of course, when I was on the drugs and I was in type 2 category with the metabolic syndrome, I had the high A1C, and then eventually I started getting told that I had low A1C, and I remember I would also get told I had low blood sugar, but they would never actually tell me exactly what it was. And that's another thing. You don't really even know if they're actually ordering the tests that they're saying that they're ordering if you don't see them. And if they don't actually show you, they could like tell you that they're doing something, but they're really not. And they could be like downplaying something that's actually really bad, or they can only tell you about what's really low or what's really high, but not what's almost low or what's almost high, which I've mentioned that before. I do remember that, like, from the start of me being forced on all the drugs that I was forced on at 12 till pretty much ever since then after that, there was always this thing where, like, after doing blood work, the doctors would always come back looking terrified, like they didn't really understand how I was still alive or how I walked in the room, and they just looked scared. So I could honestly only imagine what all my results used to say. I do know from the things that I did know used to be bad, everything is like 99% good now, actually, which I mentioned that before a couple times. Like, I used to have low iron, actually my whole life, not even just since the whole drugging thing. Now I don't. I no longer have low vitamin D. A lot of other stuff that used to be low that isn't low anymore. Like, I do know my hemoglobin wasn't low the last time I checked, and my red blood cells finally aren't low. Last time I checked anyway. And they had been low for years since the whole drugging thing. My white blood cell count is still low. In fact, I think, two different types, the leukocytes or leukophils, something like that, and then some other type. But other than that, a lot of stuff has improved. And even before I started taking the HCl, so like even when I still couldn't digest anything, a lot of things just improved, I guess, just from getting out the situation. But the last thing I have to talk about is the one check rule, or at least that's what I'm calling it. Or I put one check rule, you're good. So this is the gaslighting method. This is when doctors will tell you that you don't have insulin resistance or you don't have diabetes because they checked your blood sugar and that time it was decent or it was good. But the thing is, that's not how you check for diabetes, actually, for a lot of different reasons. But for one, just because it was at a good level then doesn't mean anything. To really actually like see how somebody's body is using sugar, you would have to do a continuous monitoring. Another thing is that they're checking for extremely high blood sugars, which that would only check for type 2. And then another thing, which I mentioned this before too, and it goes back to the whole things with like different situations I'm in. So, when I was in my previous situation, my blood sugar was always low. They were just able to say the whole, well, you're just being starved at home thing for Munchausen and all that bull crap. But now they can just say, maybe you just haven't eaten because you're a homeless orphan. And so there's that. And that's why that situation with the homeless clinic that checked and I was 80, this was another homeless clinic. Which, like I said, I don't go to doctors, but this is a long story of how the situation even happened. This was actually really recent. I mean, even the one where they checked in my blood sugar is 54, that was recent too. That was like December. Or was it? No. That was after December because wait a minute. Yeah, because I was up north for, well, I'm going way somewhere else actually. But yeah, anywho. So, what was I saying? Oh yeah. So now when they check in at its usual lows, they had their little weird excuses for that usually revolve around different accusations revolving around whether I have eaten or just different stupid stuff. But then the one time it's actually at a decent level, it was 88 or either 80, then it's like, it's good. And I've actually heard a lot of stories like this. And so, kind of the goal of this series is to get you to understand that just because you're being told that you don't have insulin resistance doesn't actually mean you don't. And just because you're being told you don't have diabetes doesn't mean you don't. There's honestly a lot of in-betweens with this.